People say the eyes are the window to the soul, the mirror through which we can connect with others. They express emotions, overflow with feelings, and can process complex images of the world around us in about 40 milliseconds. They are always attentive and draw attention for their variety of unique colors, ranging from light blue through sea green to gray purple and light brown, all the way to deep black. Nevertheless, not everyone is completely satisfied with these organs. If you could make this change, what shade would you choose? Some procedures are controversial, and not all experts agree on the risks and dangers involved in the surgery. The earth echoes through the fields and advances of medicine, and this time, this journey promises to modify our perceptions of how we see the world. In recent years, eye color change surgery has gained popularity worldwide. Artists and influencers have embraced the practice, inspiring others to fulfill their purely aesthetic dreams. It's important to note that eye color change surgery is widely used to alter the iris color in individuals with visual impairments, eyes traumatized by a retinal injury or other physical conditions that truly impact the patient's quality of life. Apart from therapeutic and functional reasons that involve the visual health of individuals, the aesthetic market has been advancing in this area, offering various possibilities for those without any real issues, but who wish to alter their image and physical appearance. For those who do not wish to undergo such invasive and radical processes, there is the temporary option of the famous colored contact lenses. This established market offers diverse options, even deviating from the natural standard of humanese. The only difficulty in this case is that the lenses require constant maintenance, proper hygiene, and occasional product replacements. However, this option is inconvenient and impractical for those who truly seek a permanent change in their lives. For these more courageous individuals willing to undergo a radical transformation, there are surgical options that permanently change the iris color. The safest technique used lately has been keratopigmentation, also known as corneal tattooing. In this procedure, there is no actual alteration of the iris color. Instead, a new color is added to the cornea, and this pigment will disguise and cover the original color in the background. To perform this surgery, a laser is used to apply the desired pigment directly to the human cornea, resulting in an irreversible modification of eye color, similar to a tattoo. Despite gaining popularity recently, corneal tattoos have been experimented with since 2000 BC, when the Greek physician Galen mentioned the method for the first time. The practice was later described again by the Roman Aetius in 450 AD. In both cases, rudimentary surgeries were used to mask iris opacity in patients suffering from glaucoma, a condition that affects the optic nerve and can lead to blindness if not treated properly. Afterward, the technique was not mentioned again until 1869, when the German oculoplastic surgeon Louis von Wecker refined the procedure. His account describes applying a layer of ink to the cornea. At that time, raw pigment was directly inserted into the tissue, piercing the cornea with a grooved needle. This method influenced the techniques used since then, which have been refined with the development of more precise and safer technologies. Currently, the practice involves creating a microtunnel in the human cornea, using a femtosecond laser, which operates at a quadrillionth of a second, through which the pigment of the desired color is injected. Performed with local anesthesia, its side effects are described similarly to those of myopia surgery. The quick procedure, taking an average of 20 to 30 minutes, ensures an immediately noticeable result, with a brief recovery period allowing the patient to resume normal activities in just a few days or weeks. Like any surgery, there are risks that must be considered. Firstly, it's crucial to be aware that color can be interpreted differently due to each individual's visual perception, requiring them to recognize themselves anew through a different perspective. Additionally, the dye may not achieve the exact level of pigmentation envisioned by the patient. In cases of additional interventions to reach the desired color, the surgery may lead to ectasia, inducing a corneal deformity similar to keratoconus, resulting in double vision. Common occurrences of allergy also exist, where the body reacts against the pigments. In these rarer but concerning situations, the patient may suffer corneal injuries through inflammations such as uveitis and secondary glaucomas, which can compromise vision. Another important consideration is that the long-term effects of keratopigmentation are still being studied, and potential changes in ocular health may occur over time. Due to the real dangers of the surgery, several medical boards worldwide do not recommend the procedure solely for aesthetic purposes. Despite being approved by the FDA in the United States, the practice is indicated only in specific cases of moderate to severe visual dysfunctions. However, this is not the only surgical option available in the aesthetic market globally. For those who truly wish to permanently change eye color, there is also the possibility of altering the iris color through corneal depigmentation. Have you ever noticed that many newborns are born with dark blue eyes and then this color undergoes changes, possibly transitioning to green, brown, or even black? This phenomenon occurs because melanin is generally not present at birth and begins to be produced over time. Eye color is a genetically determined characteristic, achieved through the production of proteins that regulate the amount of melanin deposited in the iris. The greater the accumulation of melanin, the darker the eye color. People with blue eyes, for example, lack melanin in the front part of the iris but have it in deeper regions. The depigmentation technique follows this logic and involves gradually destroying the superficial layer of melanin in the iris. While keratopigmentation functions like a tattoo, depigmentation operates as a process similar to tattoo removal by eliminating the original pigment from the cornea. To achieve this, multiple sessions with a low-energy laser are required, which heats and breaks down the protein, causing dark eyes to attain lighter shades. In each session, lasting around 30 seconds on average, the eyes undergo a quick and painless exposure to laser flashes. The more sessions, the lighter the tones revealed by the iris. However, with this technique, you cannot truly choose the desired pigmentation. This is because all humans have a gray-colored tissue beneath the colored part. Therefore, the procedure will lighten the iris but to a more grayish-blue tone. A study published in 2021 by Dr. Pedro Ruiz in Spain reviewed the results of over 1,000 patients who underwent the practice. Overall, the results were satisfactory, with few side effects such as mild inflammation a few days after the procedure. On the other hand, a recent study published in the European Journal of Ophthalmology described cases of patients who developed severe glaucoma after undergoing laser depigmentation and needed complex surgeries for reversal. Many healthcare professionals do not recommend the procedure that has been clinically applied for aesthetic purposes without official approval or licensing. The FDA in particular does not approve iris depigmentation, which still lacks studies and continues to be evaluated in clinical trials by Stroma Medical Corporation in California. Even more risky surgeries, such as iris implants, are only found in Mexico and Panama, for example. In the United States, the practice is prohibited and considered highly dangerous. In this procedure, doctors make a small incision in the retina to insert an artificial silicone implant of the desired color over the iris. However, the risk is too high and strongly contraindicated by various experts. A 2012 study from the New York Eye and Ear Infirmary describes 7 patients who underwent surgery abroad and ended up suffering debilitating eye complications. All 14 implants had to be removed, and the patients experienced severe complications. 7 eyes needed cataract surgery, 6 underwent glaucoma surgery, 5 required a partial cornea transplant, and 1 eye needed a complete cornea transplant. How far would you go to become the person you desire to be? Vanity is a delicate emotion, teetering between self-esteem and self-love. But it can easily devolve into a journey of radical changes and high-risk aesthetic procedures to achieve the considered perfect image. The beauty market continues to offer options for humans to find some personal satisfaction with their physical characteristics. While there is undoubted progress in medicine, there are also undeniable risks that should be taken seriously and with concern when saying yes to surgeries. Do you like your eyes? Would you have the courage to permanently change the color of your iris? If you enjoyed this topic, don't forget to like the video. Feel free to share in the comments the color of your eyes. And remember, Earth echoes through the reflection of this incredible human capability.